My parents are both deaf. I grew up using BSL, but I went to a mainstream school. So I used a bit of BSL with friends, but I also am able to speak and use English as well. Sometimes I use sign language with my deaf friends, and sometimes I participate in the hearing world using spoken English with my hearing friends. So I work in public health. I work for a council in South London. I've been working in different areas recently. You might have seen a bit in the news about it. The South Africa variant of the coronavirus. I've been quite heavily involved in that area of public health. They've needed a bit of help setting up some testing sites in different locations. So this is a big part of my job. This is these areas are set up for people to go and have their COVID tests done. So I basically organise, I do a bit of volunteering to hand out test kits and sort out all the operations there. And then I also collect all the feedback and pass it back to Public Health England. So I'll go back a bit and tell you a bit about my education journey. I've got a BSc in Public Health, a degree. And I'll talk to you a bit about my experiences as a deaf person with access to work. So obviously, it can be a bit of a challenge being a deaf person. I'm completely deaf in my right ear, but I do have a bit of hearing in my left ear, and I use a hearing aid on that ear. So I work around that. If I work in a small group and everybody's speaking, I can access that using my hearing aid. If it's more people than a small group, I do like to employ an interpreter to help me out with comm support. Now things are remote. You might have heard of MS Teams, which is very similar to what we're using tonight, Zoom. But MS Teams has built-in captioning. So that's really helpful for me to access. If I don't understand what someone says, I can use the captioning. And as I say, I do have a bit of hearing there, which I can use for my meetings. This means that some people will speak into my left ear because they know that's my good ear, and they know I can use the hearing that I do have to access some spoken word. In the office, though, I do tend to use interpreters for my meetings. I do have an access to work budget as well, and that pays for my interpreters. So if I'm having an issue at work and I feel that I can't access something, I will always confidently ask for adjustments to be made. And this is face-to-face and in the office. I don't like people, for example, to come up behind me. I like to sit with more like my back to the wall in an open plan office so I can see people coming up to talk to me. So it's really important to make your needs known to your employers, your colleagues, your workmates, and I'm always quite confident to do that. It's important to have that confidence within yourself to make your needs known.